this is Amy Monaghan with EHR TV at HIMSS 2012 in Las Vegas. Today I'm with Jim Decker, Senior Vice President of Sales and Marketing for Intivia. Jim, thank you for being with us today.
Thank you for having me.
Great. Can you tell us a little bit about Intivia?
Sure. We are celebrating our 10th year in the healthcare space this month, actually, so we're excited about that.
Congratulations.
Thank you. We provide electronic health record, practice management, and revenue cycle management services, in addition to transcription services as well. So we've been in the 1 to 10 provider ambulatory space for, as I said, 10 years, providing service. So we feel we have a good understanding, a good handle on not just what products and functionality that marketplace needs, but also how to properly implement, train, and support our clients. And that's really probably what we would consider our main differentiator.
Tell me a little bit about what you're showcasing at HIMSS this year.
Sure. I guess what we've been showcasing here at HIMSS is the entire workflow from start to finish, using our completely integrated EHR PM system, and then obviously flowing into revenue cycle management for those physicians' offices who would like us to handle their billing and collections as well. So we feel we provide a very good one-stop shop for the 1 to 10 provider marketplace. We have a low barrier to entry in terms of a relative cost of getting started on our system. We have a tremendous success rate in terms of getting our doctors implemented, attested, and collecting their meaningful use money in very short order. And so all of our years of providing service in this marketplace is starting to pay off in terms of being able to assist our doctors with the implementation, training, and leading to attestation and a successful, meaningfully using our software. So we feel that all of our hard work over the years is really paying off now, because as this industry turns a little bit more away from the being a product-centric industry, which it has been for years, to a little bit more of a service related industry. Now obviously you need a great product, and we're certainly proud of our EHR. It's taken years and many man hours to develop, mostly with feedback from physician client base on what they need and what the unique needs of the 1 to 10 provider marketplace are. And so now we've added revenue cycle management services, really as a response to our existing client base requesting that we start to provide more services, because we feel we strike a very good balance between software and service as a company as a whole, and that's really our main strength in the marketplace.
Tell me a little bit about how your product is deployed.
Yeah, excellent question. We are a true ASP solution, so we've got our application up there in the cloud, and there are still some physicians who would prefer to have that application run from servers in their office, which we certainly can provide and support. But as healthcare in general moves into the cloud, we feel uniquely positioned because we are a true ASP, and that is how we deploy now. It seems to be faster, more cost-effective, and extremely easy for the doctors to deploy, and obviously it reduces some of the infrastructure requirements that the individual provider might have, as well as the upfront cost.
Speaking to physicians in the past, I realized that for the smaller groups, and you said you're in the 1 to 10 marketplace, that it's easier for them to go with a web-based solution like yours in the cloud than to go with the server-based. So it's great that you can offer them that piece of technology.
Yeah, absolutely. I mean, we found out early on from our clients that supporting an IT infrastructure in a small practice sometimes is costly. It's inconvenient, and really it takes the doctors away from their primary goal of providing the best healthcare services they can to their patients. So rather than having them take on a burden of an IT staff or an IT infrastructure or backing up of data and all those things that come with the technology, most of our physicians would prefer we host it in the cloud, handle all the backup, handle all the infrastructure requirements, makes it very easiest for us to deploy enhancements on a regular basis to the product with little or no inconvenience to our users. So we certainly feel that for our marketplace, it's the best solution.
So it sounds like you make it pretty easy for the doctors.
Yes, we've had a kind of a no-hassle approach to healthcare for our 10-year history, and we continue that to today. We still feel, obviously, our clients' primary objective is to provide the best healthcare services they can at the point of care, and we're really there to help facilitate that, and not to take over the process and not to take over their office, but simply, hopefully, provide them with a mechanism where they can have all the information they can possibly get at the point of care so they can make the best decisions for their patients.
What's on the horizon for you guys?
Oh, a lot of initiatives. Based on our transcription business, we have many clients who wish to continue dictating as their main method of documenting encounters, and so we're starting to roll out all kinds of meaningful use services for physicians who prefer to dictate, including intelligent language services and things like that that allow the dictated words to be parsed out and structured as meaningful use, which is extremely appropriate on a day like today when they've announced stage 2 meaningful use guidelines.
Exactly.
And so a doctor who may have thought in the past that they were going to have to stop dictating, which was their primary and preferred method of documenting, and start working more closely with the computer, now have due to some of the changes in the technology, now have the opportunity to really continue to document the way they have in the past, and yet still get all the benefits of an EHR, still achieve meaningful use, stage 1, 2, 3, 4, or whatever they have in store for us going forward. And so that's one of our major initiatives going forward.
Okay, well, fantastic. Jim, thank you so much for taking the time to be with us.
Thank you for having me.
This is Amy with EHR TV at HIMSS 2012.